More children in Virginia are facing mental health struggles than ever before. These startling statistics come from the American Academy of Pediatrics. 10 News reporter Sydney Jackstimer working for you tonight. She's live in the studio and shares the hurdles that these kids are facing. Sydney?
Yeah, well, John, the demand for children struggling with their mental health continues to increase. The number of providers available is dwindling. Many families are met with a long waiting list when trying to get their child help. According to the latest information from the Virginia chapter of the American Academy of Pediatrics, 90% of doctors they spoke with say they saw an increase in demand for mental health services. Despite the large percentage in need, 62% of those providers said they are not able to meet the demand.
So not only do we need the mental health, but then we don't have anybody to provide the service. So these youth are really struggling with their mental health symptoms and aren't able to gain access to people who can help.
Clinical Director of Family Service of Roanoke Valley, Sarah Herrig, says the demand is so extreme, their office is dealing with a wait list.
I mean, we have a wait list. I don't know any provider in the area who doesn't have a wait list, and if they don't, maybe they're scheduling out several months in advance for these folks. And that's for all ages, but especially, again, for youth.
Out of the nearly 125,000 children in Virginia who have experienced at least one major depressive episode, 60% of them did not receive any mental health treatment. Some signs parents and caregivers should be on the lookout for.
Things like, withdrawal from activities they might have enjoyed before, isolation from their loved ones, from their friends, that kind of thing.
So what can parents do when met with these hurdles while trying to help their children?
Trying to create a space for their teen to be able to talk about, or their child to be able to talk about what they're struggling with.
Experts also recommend when you are met with those long waiting lists to get on them. Sometimes they do move faster than you would expect. Also looking into telehealth and virtual therapy as another option. Reporting in the studio tonight, I'm Sydney Jackstimer, 10 News, working for you.